Dr. PAYAL KOHLI, welcome to the Valerie Beebe Show as I talk to people across America. And you've got such an important topic. I want my audience to know that Dr. PAYAL KOHLI is here. She wants you to know about heart disease. She says in her profile that it claims the lives of more women in the U.S. than all forms of cancer. Shocking, Dr. KOHLI. Could you describe what's going on? And I think there's a cholesterol crisis.
You know, I'm so glad that you called it that, because it really is a crisis. And what makes me even more shocked is that 80% of heart attacks and strokes, according to the American Heart Association, are preventable with risk factor modification and lifestyle changes. So we know the answer. And yet, heart disease is the #1 killer, not just of women, but of men as well. And I think what we're realizing is that it's not just how high your cholesterol is, but for how long it's been elevated. Because we've got millions of Americans walking around thinking that they're healthy with mild or moderately elevated levels of cholesterol in their 30s and 40s. And if you think about cholesterol as a poison for the arteries, it sort of sticks and sticks and sticks, and then it doesn't really manifest itself until it develops significant blockages with heart attacks and strokes later in life. So we're really trying to kind of catch the disease early, treat it aggressively, and talk about the urgency to try to reduce cholesterol, because it is a silent killer. It doesn't declare itself until it's too late.
What's the difference when you said men and women? Is there a different way of diagnosing men and women for cardiovascular disease?
Well, you know what's different about them is that for the longest time, even us in the medical community actually thought that heart disease was an old man's disease. So we weren't studying the women. We weren't treating the women. We weren't screening the women. And that's what has created some of this problem. And even today, only 44% of women, less than half, actually know that heart disease is the #1 killer of women. So I think we have to do better at educating our female patients. We as females need to be more educated about our risk. And we need to understand that we don't just have those traditional risk factors, you know, the high blood pressure, high cholesterol, obesity, diabetes, the usual stuff. But we also have female-specific risk factors that increase our risk. So, for example, how we carry our pregnancies can actually determine our risk of having a heart attack or stroke later, because that's a little bit of a stress test on our heart when we're pregnant. What age we have menopause at, whether we have arterial calcifications on our mammograms, which is, you know, something not related to breast cancer, but it's the arteries starting to harden and stiffen in our breast that portends for us that it might be happening around our heart and our other blood vessels as well. So we just need to do better with our women all around.
You have said a lot of things going on there for just women alone. Why may women be reluctant to take cholesterol-lowering medication? Is there reluctance there?
No, you know, I don't think it's actually a reluctance more than an obligation, because the problem is that the medicines that we use to treat high cholesterol reduce somebody's risk, make them live longer, reduce their chance of having a heart attack or stroke, are sometimes not well tolerated by women. And what I mean by that is, you know, taking a statin or taking even a higher dose of a statin to get you to the appropriate level could result in sort of, you know, life-changing muscle symptoms like muscle aches and pains, fatigue, to the point where you're not able to get about your daily life. So asking a woman to take a medication that, you know, causes severe muscle aches or pains every day to reduce her risk of a condition that is going to manifest itself many years later is a tough ask. And so what we've unfortunately done in the past is we've just left these women untreated or undertreated. We don't have their cholesterol where it should be, or we just don't give them statins at all. And there's really been a huge gap, just a gaping hole. And I like to call them the forgotten children, because we just sort of shrug our shoulders and move on. And that's what makes me really excited to be working with Esperion, because we now have a medication that is specifically targeted to patients that have statin intolerance. And this medicine doesn't get activated in the muscle, so it doesn't cause a lot of those muscle aches and pains, but it does lower your cholesterol, and it does reduce your chance of having a heart attack, stroke, or dying from heart disease. So it's a really nice option in our toolbox now for treating those patients that in the past we had just sort of turned our backs on.
Is that the latest clinical trial that you're aware of?
Yeah, so this was just a trial that was presented just about a month ago at the American College of Cardiology meeting. And it was very, very exciting because it studied this population of patients that can't take much of a statin or can't take any statin at all. And there were about half women in the trial. And it studied patients not only that already had heart disease, but also some patients that were high risk for developing heart disease. And it was a positive trial. So it makes me really excited that I now have this option to reduce not just my patients' cholesterol, but actually reduce their risk of having a heart attack, stroke, or dying from heart disease. And I can do it in a way that allows them to, function. It's well-tolerated medication.
And finally, why are trials important for women, and where can women go and find out more information?
The trials are so important for women, and I think that this trial has opened the door for D&I in clinical trials, because in the past, we had really only been studying one single population that was largely Caucasian men, and we were systematically excluding women because they might get pregnant or they might have menopause or, what have you. But now we've realized that we can't design treatments for women, treatments for minorities, unless we actually study those in our clinical trials. So I was really excited to see this trial enrolling nearly half women. And I think if you're a woman who either, can't take a statin or can only take a lower dose of a statin, then it's a really good idea to go talk to your doctor, try to determine your risk, try to think about whether you need screening tests like a calcium score, which is an x-ray of the heart. And depending on what those show, if you want to learn more about this medication, you can go to www.asperion.com and try to see if you might be a good candidate for this medicine.
I want my audience to know that Dr. Kohli is an associate clinical professor of medicine at the University of Colorado School of Medicine. Dr. Kohli, this has been so eye-opening. I have never thought about separating that condition for men and women, but that's why you do what you do. Thank you for stopping by and being a guest on the Valder Beebe Show. I really appreciate it.
Thanks so much for having me.
I'm Valder Beebe. I broadcast on radio, streaming TV, podcasts, and in print publications. I interview the world's most fascinating authors, all because I love a good book. This summer, I partnered with WPS for BB's Summer Book Giveaway. We're giving away New York Times bestsellers and award-winning books. Books that inspire me, and I'm sure they'll inspire you. To be eligible to win a copy of Jesus Can Give You a New Life, answer this question. What is God's greatest gift to mankind? You'll find the answer in John 3:16 of the Bible. Send your response to the email at the bottom of the screen. I'm Valder Beebe, and I'll see you for the next BB Summer Book Giveaway.